Hello, this is Dr. Dean Jabs. Let's talk a little bit about breast lift, which is a mastopexy, versus a breast reduction, and what the differences are and how you know which you need. Typically, people seek a breast lift when the nipple is below the crease and they have enough volume in their breast, but it's just sagging. So the breast is made up of, the breast shape really is comprised of two things: the breast volume and the skin brassiere that holds it. Now, typically in an old style mastopexy, what we did was we didn't address that volume, we just tightened the skin. This looked great for a short period of time, but after a few years, things started to sag and you were back to where you started. What we've done now is we've developed something called an auto augmentation mastopexy. And what that is that the nipple that is drooping is left connected to tissue below, brought into position, and the majority of the tissue that is sagging down is separated from the nipple, a pocket made beneath the nipple, and the other tissue, it's brought up and attached to the chest, and then the remaining tissue formed around that tissue that was brought up. This leads to fullness above, a greater projection, and a longer lasting result. Now, the difference between a mastopexy and a reduction is that that tissue that we use to bring up onto the chest wall in a reduction is removed. This makes the breast smaller, but you still have enough to provide projection and a good look. The incisions for this are around the nipple, typically down the center of the breast, with a small portion on either side depending upon how large the breast is, how large the lift is, or how large the reduction is. All the sutures that are on the breast are subcuticular running sutures of a material that dissolves. What this means is you don't see any stitches on the outside. Everything's inside, and then tape is placed on the skin. This is not a painful operation. It's something that we do in the office. You don't need general anesthesia typically, although it is always available here. But it can be done if you're concerned about anesthesia under sedation and then just infiltration of anesthetic. Should you have any questions, please feel free to call the office at 301-493-4334 or go online at cosmeticplastics.com and come see us. We'd love to talk to you. Thank you.